The aorta is the largest blood vessel in your body and a vital pathway for all oxygenated blood coming from your heart. This blood vessel can weaken, causing an aortic aneurysm.
I think the one thing we need to realize about abdominal aortic aneurysm, which we call AAAs, is that they exist. A lot of people don't realize they have this particular problem. It can be a silent killer, but it's one that if we get an early diagnosis, we can make a great treatment and extend someone's life. It can be painless. It can be unnoticed. That's why we've started to promote screenings. But if it does become symptomatic, usually the patient can have abdominal pain, back pain, leg pain, and unfortunately if it ruptures, it can be a catastrophic problem. Then it can have a distended abdomen.
There are millions of Americans at risk, but understanding the symptoms and risk factors can prepare you to take action.
The screen is a great thing. It's one of those diagnostic tools we use to make an early diagnosis of AAAs. It's non-invasive, usually with ultrasound, to detect the size of your abdominal aorta. Normally it should be about 2.5 centimeters. When it gets larger than that, we started calling it aneurysmal. Okay? When it gets over 5 centimeters, it needs to be treated. Everybody who has a family history of AAAs, in other words, if I had a father who had a AAA, or if I had a brother who had a AAA, should be screened because it does run in families. Okay? Anyone over 60 who's smoking cigarettes should be screened. And actually, you know, in today's population, I'm really stressing to younger people, and I'm talking about younger people, I'm talking about in the 40 range, because we're starting to find some aneurysm in that group too.
Early detection can help save lives.
Well, the first thing that's going to happen to you, they're going to expose your abdomen, they're going to rub some jelly on your belly, so to speak, as we say, and they're going to put a probe that's going to get non-invasive, no pain, and they're going to make some pictures of your abdominal aorta, and then we can detect the size of it. I think, again, when you get in that age range, especially when you get over 60, I think you need to get checked just to make sure that you don't have a dilated aorta. It needs to be followed. You know, not everyone we find a dilated aorta, aneurysmal aorta, needs to be surgerized, but they need to know about it so we can follow them. Most of those patients we follow every 6 months because they do grow, and there's some things that we can do maybe to retard the growth. Concentrate on cigarette smoking, the diet, blood pressure, those things that can make the aneurysm actually get larger.
CHRISTUS St. Francis Cabrini Hospital and Aneurysm Outreach will host a free abdominal aortic aneurysm ultrasound screening clinic for those most at risk on Friday, December 7th in the Cabrini Women's and Children's Hospital atrium from 8 until 1. For more information or to register for the free screening, call 318-448-6780.
The Medical Minute is brought to you in part by CHRISTUS St. Francis Cabrini Hospital.